Hey y'all, my name's Brittany Mesquick, and I'm a suicidologist and program director at Ellie Mental Health. I've been working in the field of suicide prevention, intervention, and postvention for almost 15 years, and I'm here to tell you about some of the most common myths associated with suicide. The word commit has a negative connotation and can contribute to the stigma associated with suicide. Fact: even though the word commit is frequently used by people when they talk about someone who's died by suicide, it tends to have a negative connotation. People commit crimes, they commit sins, some people are psychiatrically committed, and so using the word commit can actually contribute to the stigma associated with suicide. A more appropriate phrase to use would be someone died by suicide. People who talk about suicide aren't serious and won't go through with it. Myth: people who talk about their thoughts of suicide don't want to live with the way things are right now. It's not necessarily that they want to die. And one of the things that we know about suicide prevention is that most of the time, people can talk themselves out of it if they have the opportunity to talk about it, which means they just need a listening ear. If you ask someone if they're thinking about suicide, you might put the idea in their head. Myth: this is actually one of the biggest myths out there associated with suicide. Humans are not that easy to influence. Naming it isn't going to make it more appealing to them. And research actually shows that if you ask someone if they're thinking about suicide, it can give them a sense of relief, what actually means it's helpful to ask. Suicide is not an impulsive act. Fact: most suicides are carefully planned and thought about for weeks, months, maybe even years. In fact, some research shows that about 95% of suicides have been carefully thought out before someone dies by suicide, which shows that most of the time, suicide is not an impulsive act. All people with thoughts of suicide are fully intent on dying, and there's nothing you can do about it. Myth: I would not be a suicidologist if I believed in this one. People with thoughts of suicide typically have ambivalent thoughts, which means part of them wants to die and part of them wants to live. We want to focus on the part of them that wants to live. Suicide rates are highest in the spring. Fact: now I know what you're thinking. Most people do think this. People think that suicide rates are highest in the winter and around the holidays, but the reality is that they're highest in the spring. And research shows that that stands true across the country, even in places where it's frigidly cold throughout the winter. Suicide notes are only left behind by about 25% of people who die by suicide. Fact: suicide notes are only left behind in about 25% of cases. When I worked in Louisiana and responded to the scene of suicides, it was frequently the first question that family members asked. Did they leave a note? Unfortunately, it's been my experience working with survivors of suicide loss that when notes are left behind, it tends to just bring more questions and not answers. Suicide is the second leading cause of death for children ages 10 to 14. Fact: suicide is a public health issue that significantly impacts our country's youth. Having the conversation with youth in our country about suicide is an important part of suicide prevention. Suicide is preventable, and we all have a role to play in suicide prevention. Help us spread the word about the resources that are available. If you or a loved one are in a mental health crisis or thinking about suicide, you can call or text 988, the National Suicide and Crisis Lifeline. You can also chat at 988lifeline.org.